Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. I'm joined by Dr. Celeste Straight, and we're here today to talk about postpartum depression. So my first question for you is, what is postpartum depression?
That's a very good question, Brittany. Actually, postpartum depression can manifest in many aspects. Typically, it is very similar to what you would expect as depression as a clinical disorder. However, you can also experience anxiety, and even in extreme forms, sometimes postpartum depression can manifest as psychosis. So it can be a very severe disorder.
When does postpartum depression typically present?
So usually most women will start experiencing some symptoms of postpartum depression around 2 to 4 weeks after they deliver. We do experience some symptoms of what we call baby blues within the first few days to few weeks after delivering, which can be tearfulness, anxiety, some increased fatigue and concern about bonding with the baby. But however, if you do notice that you're developing extremes of those symptoms, like unable to perform your day-to-day functions, if you're concerned about harming yourself or the baby, or concerned about bonding with the baby, then those are some symptoms of depression.
Can a woman begin feeling symptoms of postpartum depression while still pregnant, and is this called something different?
Absolutely. So women can manifest symptoms of depression throughout their pregnancy, particularly if they have a history of anxiety or depression themselves. So it's something that we screen for throughout pregnancy, at the beginning of their pregnancy, in the middle, and at the postpartum visit. And we're well aware to check for it during your postpartum stay after delivery and throughout your prenatal course. It's not particularly called anything different, but we do keep a close eye for patients who may be at high risk for developing that.
Are there triggers for it, or is there anything a woman can do to help avoid this?
Certainly having a mental health history, so if you know you have a history of depression, anxiety, or a history of postpartum depression itself, that's something that you should talk with your doctor about during your prenatal care, because there are lots of options for treatment that include medication treatment and other non-medication forms such as therapy, counseling, and even some non-allopathic forms like acupuncture, massage, yoga, and meditation that can be helpful throughout the prenatal course and even after delivery.
At what point should a woman seek help for her postpartum depression?
Anytime a patient has any concern whatsoever, their physician will be happy to speak with them or see them in the office. There's no time that's too early to ask for some help. We're happy to speak with you and see you anytime after delivery, and that's part of the instructions we give our patients before they go home with their new baby. But certainly if they're concerned about how they're able to care for themselves or their baby, how they're bonding with their family or their new baby, or if they have any thoughts of hurting themselves, their baby, or anyone else, we would want to hear from them immediately.